She needs to ask you some questions. She needs to see you.
Okay.
How did you get caught?
Do you mind if you take off your glasses and hood, Barbara?
Can you take off your glasses, Barb?
What are we doing here? Why are we here, Barbara? Don't look around. Don't look around. Don't look around now.
Okay.
We're watching you.
So what brings you in today? Thank you for that.
Well, this is my sister Barb. I haven't seen her in years. This morning I walked outside, got into my car, looked up, and Barb was trying to jump off my roof. Right,
Sit
Barb?
low. Sit low.
Flying.
She was trying
I
to kill
fly.
herself.
Do you mind if I talk to
I
your
fly.
sister? Oh, do you mind if I talk to you in front of your sister?
Keep it quiet.
It's okay.
Okay, good. So why are you here today, Barbara?
Sonia brought me in. Not sure why.
And tell her why I brought you in.
Yeah, we all
She
follow.
was trying to jump off my roof this morning.
Why were you trying to jump, Barb?
Nobody understands. Nobody understands. I wasn't jumping. I wasn't jumping. I wasn't
What were
jumping.
you doing?
Remember the plan?
Tell her.
The
Remember
plan.
the
I have a plan. We have a plan.
She thinks she can fly.
The plan.
What's the plan?
The plan to get to the satellites to turn them off. Plan.
Right.
Plan. We're gonna fly. We're gonna fly away.
Who are you talking to?
My protectors.
Remember, we talked about this.
They're the
You don't
executive
have a
committee.
protector.
I am the president. We know how to save the world.
Oh, yeah?
Mm-hmm.
How are you going to save the world?
Once I can take off and fly, I can get up to the satellites, and then I can get into them and reprogram them and mess with the conductive thermal nuclear aspect. Okay. It's too much information.
Are there any family members with with mental illness as well?
Our father had schizophrenia.
Oh, did he?
Mhm.
Okay.
Dad.
Because schizophrenia tends
Yes.
to, there's a genetic trait involved in that. And there's
What
really,
else?
Did you
Because
know
I
They
don't
said
have
Dad
this.
was crazy. I understood him. He wasn't crazy.
You got
They
it
all-
right.
They all thought he was crazy. I knew.
She's spying you through the glasses.
yeah, there are many different causes of schizophrenia. I'm sure you've already dealt with the doctors before about this, but genetics, it could be abnormal
Don't look
chemical
around, we're
imbalance in
here.
the brain.
We're
so
protecting you.
many different things. The exact cause of paranoid schizophrenia isn't known. However, certain factors like having a family history of schizophrenia, being exposed to viruses and poor nutrition while in the womb, experiencing stressful or traumatic life situations, and even taking psychoactive drugs during adolescence can increase the risk of developing or triggering this condition. Our main concern is to keep Barbara safe and also get her regimented on her medications.
We'll be-
Safe. They
We'll
don't
be right
know
back,
what
Barbara.
safety is. They don't know who's after us.
Who's after you, Barb?
The suits. The FBI, the CIA, the NSA, the Homeland Security with the satellites.
Don't say too much.
Okay. We're going to get the doctor in here to see you as well, to see what medications he's going to prescribe for you
I
this
can
time.
save the world. I know
Okay.
how.
But it's up to you to also comply with
It's
the
all got
medications
to
we
do
give
with
you.
what's right here.
Have you been to a doctor before?
Yes.
Okay, and did he tell you anything about what you were diagnosed with, or
Don't look around.
Yes.
what?
Paranoid.
Okay, and have you been
Schizophrenia.
schizophrenia?
Paranoid schizophrenia.
Okay, and did he give you any medications to take?
Meds. I don't like meds.
You don't like them? Why not?
Funny. Make me feel funny.
Okay, what kind of medications were you on? Do you remember the names of them?
Lots.
Any like antipsychotics, Haldol, Risperidol,
Yes.
Abilify?
Yes.
That's
Yes.
a
lot of
code.
them.
That's a code. Keep it quiet.
Treating this disease requires a lifelong commitment. Some of the main treatments for paranoid schizophrenia are medications, psychotherapy including individual therapy and family therapy, hospitalization during crisis periods or times of severe symptoms, electroconvulsive therapy to reduce some of the symptoms, and vocational skills training to learn how to live independently. The most commonly prescribed medications for this condition are traditional first-generation antipsychotics like Thorazine, Prolixin, and Haldol. Atypical second-generation antipsychotics like Risperidol, Seroquel, and Abilify are also used. Are you talking to someone?
Yeah.
Oh, who are you talking to?
It's a secret.
My
Don't tell her.
protectors.
Your
My
protectors?
protectors.
Tell me a little bit
There's no
about
one
that.
there. There's no one here besides me.
No, they're protecting me. They're protecting me. Because the guys in the
Can you help
suits
her?
with the dark
Can you please help
sunglasses
her?
are all over the place. They're always watching me.
Yeah,
They're FBI, they're CIA, they're NSA, they're Homeland Security. The satellites, they're always watching me.
Don't ruin it,
And
Barbara.
how long have you been hearing these voices?
Stick to
They've
the
been with
plan.
me always.
Plan.
Always. Always. As long as I can remember.
She's got cameras in those glasses.
Do you have cameras in those glasses?
No cameras.
Are
in
you
my
are you
glasses.
taping me?
No, I'm not.
Are they listening? They're listening. They're listening to us.
I
They're
promise-
listening to us. They're listening to
Barbara,
us.
no one's
Barbara,
listening
she
to
wouldn't
us.
tell you. She wouldn't tell you.
I promise you no one is listening to us. Just me, you, and your sister here, okay?
What we need is to get her back on medication. That seemed to really help her. Why did you stop taking your medication?
'Cause I didn't like it.
Why not?
Agitate. I got agitated. I was
Okay.
shaky. I didn't like it.
Okay, so you had some side effects from those drugs?
Yeah, I didn't like it.
Tell
Didn't
her
like
why you
them.
went off them.
I don't like
You
them.
didn't? They didn't?
Don't like them.
Okay,
They made her shaky.
okay.
She paced back and forth, and she went off them, and I never saw her after that.
Okay.
Where the
So look, they left me. The voices left for a minute, so I can tell you.
Okay.
So they're the FBI and the CIA and the NSA.
Mm-hmm.
What's the new one? Homeland Security
I think
with
so.
the satellites,
Mm-hmm.
the black suits. They have sunglasses. They're out there. They're coming to get me. They're coming to get me.
Barb, no one's coming to get you. And
Okay,
you're in
and
the
the
hospital.
voices said
You're here
not
to
to
help.
tell you. They
You're here to
said
get
not
help.
to tell you because then I'm gonna get in more trouble.
Okay, what's going on here? What are you saying? Did you tell them everything?
No, I didn't say anything. I didn't say anything.
Well, we're gonna try and get you in here, and our first priority is to keep you safe and also to get you regimented on your medications so that you take them every day to lessen the voices you.
The main priority is to keep this patient safe and free from injury. It is important for the nurse to promote trust with the patient by being consistent and being aware of any behavior that may be perceived as threatening. It is also important to decrease the patient's anxiety level and ensure compliance with medications. Because the mistrust and paranoid behavior often leads to social isolation with the patient, having successful interactions between the patient and others is an important goal that can enhance the patient's success after discharge.
I like medications. So no, I don't like medications.
Barb, you need to take the medication.
I don't want to take
Remember, it
them.
helped you last time. You had a job. You had a home.
Can we stay with you?
You can stay with me.
So she'll be able to stay with
You
you
are a
after
part of us,
discharge
remember?
here? Okay. And will you make an effort to take your medications regularly?
Who needs
She will have to
medications?
if she's going to stay with me.
Those are codes.
Otherwise, you can't stay
They're
with
speaking
me.
codes now. Look at her
Do you know
glasses.
that, Barb?
She's
You hear
spying
that?
on you. She's spying on you for the glasses.
I'll take the meds.
Okay.
With effective treatment, Barbara can manage the symptoms of paranoid schizophrenia and work toward leading a happier, healthier life.